Prostate cancer is the second leading cause of cancer death in American men. So when should you be screened? And what is the best treatment? Dr. Greg Zimmerman of Morris Urology is here to tell us. So let's start right there. When should you start having your PSA checked?
Well, the recommendations are 50 for most men, unless you have a family history or you're African American. At that point, it's 40.
And does an elevated PSA always mean you have cancer?
No, that's what's not perfect about the PSA, and there have been a lot of controversies about PSA. An elevated PSA can be caused from inflammation, irritation, an infection, or even, just irritation from riding a bike or something like that.
And I know the usual medical formula is if your PSA is under 4, you're okay. Is that correct?
Well, that's the guidelines of 0 to 4 is okay, but that doesn't take into account the patient's age or what the PSA is doing over time.
So if it's the change rate then,
that's
not necessarily the PSA.
That's the most important thing. So if someone has a PSA of 0.5, which is well within the normal limits, and the next one is 1, and the next one is 2, all of those values are normal. However, there's been a double each time they've gotten a PSA. That person you have to be worried about. If someone has a PSA of 5 and it's been 5 for years, then that may be what's normal for them.
Mm-hmm. When should you decide to have a biopsy?
Well, using the PSA and the digital rectal exam are the two ways that we determine if someone needs a biopsy. So the PSA, as we talked about, if it rises or if it's above the range, we may decide to do a biopsy, or if there's a nodule on the rectal exam. At that point, we would counsel the patient on the risks and benefits and the positives and negatives of a biopsy.
Are there risks?
There are risks. I mean, the biopsy is done transrectally, which means you do go through the rectum, and we do typically prophylax with antibiotics. To prevent infection. There's a very low risk of an infection, but it can happen.
Can it spread the cancer?
No, that has never been found.
If you do have cancer, prostate cancer, are there various types of prostate cancer that require different treatments?
Almost all prostate cancer is called adenocarcinoma, but there are different grades. It's called the Gleason score. And if the Gleason score is low, that's typically a very slow-growing cancer. If the Gleason score is high, that is one of the rarer but very fast-growing cancers. And that may impact how you treat the patient.
So if you're going to treat the patient, there are a number of options you've got. You've got radiation, you've got surgery, you've got some other things as well. In your list, what's the best option and what's the least effective?
You have to take the patient's typical case in context. Some people watching it or doing what's called active surveillance is the best option. Certainly in an older man who has a low-grade prostate cancer, if they were to have not a long life expectancy, watching it is certainly what you would do. But in a young man with prostate cancer, typically you're looking at surgery versus radiation. Typically, young men or men that are healthy or have highly aggressive prostate cancer, they will opt for surgery most of the time, where older men or people with significant medical problems might opt for radiation more frequently.
And what's the batting average now in surgery for retaining the ability, not having incontinence or impotence at the end of the day when you've had the prostate removed?
Well, it used to be that you get the cancer out and that whatever else happens, happens. But as we've learned more about the anatomy, now you want to get the cancer out, you want to preserve continence and preserve erectile dysfunction. So it all depends on patient age, what their continence or erectile function is prior to surgery. Certainly it won't be better, but we try to get people back to what they were at the pre-op level.
Okay. Doctor, thanks for coming in.
Thank you very much.
Sharing your wisdom. We appreciate it.